And the conclusion from the FDA at that time is written in a paper in the Journal of the American Academy of Dermatology by Dan Wasowski, and in a report which you can get online from Marilyn Pitts, is that there was good evidence that Accutane could cause depression and suicidality. The primary evidence that was pointed to was 41 cases of challenge, de-challenge, re-challenge, which is when someone takes the drug, they become depressed. The depression clears up when they go off the drug, and then they get depressed again when they go back on the drug. And that series was reported to the FDA. It was presented by the FDA official, Marilyn Pitts, at that conference. Dan Wasowski also presented 37 cases of completed suicide reported in the U.S. That number that's been reported to the FDA is now up over 500, and there's an even larger number of unexplained deaths following treatment with Accutane for the treatment of acne in people who are typically in their 20s. The fact that you see a challenge, de-challenge, re-challenge is evidence alone of a causal relationship between a drug and an outcome, as you can see in the textbook of pharmacoepidemiology. There's been this myth or propaganda that's been perpetuated by the manufacturer, originally Roche, and then others in the dermatologic community, that there's no evidence for an association, and that's simply false. You don't need to do a clinical trial where you randomize people to a drug versus a placebo with the outcome of completed suicide to prove that a drug can cause completed suicide. Now, I'm not saying that everybody that takes the drug becomes depressed. That's obvious. But I am saying that every time that someone takes an Accutane pill and it passes their lips, it's having an effect on their brain. Whether or not it gets to the point that it causes clinical depression or other side effects it depends on individual circumstances. We did a study where we showed that there's a 28% decrease in brain function in a brain area that plays a key role in mood.